The Hepatitis Foundation International has designated May as Hepatitis Awareness Month. The word hepatitis means inflammation of the liver. This infographic is an easy way to find out if you are at risk. For instance, if you were born between 1945 and 1965, you are 5 times more likely to have hepatitis C. The specialists at Advanced Gastroenterology and Surgery Associates explain the difference between hepatitis A, B, and C and how they are treated.
Hepatitis is a viral infection. The reason why it's called hepatitis is because these viruses have an inclination for the liver. They will cause whether it be acute or chronic inflammation of the liver. Hepatitis A is a short-acting, it is an acute infection. It does not lead to a chronic infection. And it can be contracted orally, meaning eating contaminated, for example, seafood, raw seafood. People will get sick, but then the immune system will help them to get over. The virus does not linger. Hepatitis B and C, of course, they can be acute, but they also cause chronic inflammation to the liver.
The risk factors for getting hepatitis are mainly parenteral usage, either from intravenous drug abuse or in the past blood transfusions. This was before the blood banks were able to test for hepatitis C. In the old days, in tattoo parlors where needles may have been shared, that would be a risk of transmission. That's the difficult issue with hepatitis C. It really causes acute symptoms where patients may be sick or get jaundice like you do with hepatitis A and B. The symptoms can be very subtle, so it's very rare that we would see someone with acute hepatitis C. But it develops chronic liver disease, which means that the body's immune system has not killed the virus, so the virus remains within the body. And it rarely causes symptoms. Most patients may complain of just feeling a little bit fatigued, which you can attribute to many other different things. However, the vast majority of patients are totally asymptomatic.
We've included a link to the infographic along with more information on the treatments and surgical procedures available at AGSA under the Hepatitis Awareness Month story link on our homepage, yourhometownhealth.com.